I'm Dr. Kishore Pahuja from Natasha Eye Care and Research Center, Pimpri Sodagar, Pune. Today we are going to talk about cataract because cataract is a very common disease, and especially in the old age. Now even the younger people, because of the quality of vision, they want a good quality of vision. So this has become the integral part of the practice. Uh, First, I'll talk about that what is cataract. It's actually the opacification or cloudiness of a lens inside the eye. It's usually because of an age and also associated or it is increased when you have an diabetes, hypertension, or you're taking an steroids, if you have an asthma, or also some patients genetically, if their parents are having a cataract at an early age, they can get it. There are a lot of myths about the cataract also. Like it said that cataract should be operated when it is mature and it is ripe. That is not true. The cataract should be operated when it disrupts the vision. Now, disturbing of the vision can be, suppose if you are driving at night and you have a problem for the driving, it can be operated. If you go out in the sun and if you have a cataract just in the center of your eye, and if you go out in the sun and if it disturbs your vision, then I think it should be operated. Cataract can be treated or it can be treated with an eye drops. That is not true. And surgery is the only solution for a cataract. If you think about it's people think that because it's in a surgery, so they think that cataract is a very risky procedure. I think it's not. The cataract is the safest procedure which is done all around the world today. People say that if you do a surgery for the cataract and after that you can again get a cataract, which is not true. But there isn't a possibility when you remove the cataract, there isn't a possibility of getting a posterior capsular opacification which comes, and that can be treated with a very simple procedure like an yak capsulotomy. Cataract is cataract is a leading blinding disease in India, and the risk increases when you have a diabetes, it increases with an age, it increases with a high blood pressure, family history of cataract, excessive exposure to sunlight, and also if you have an injury to the eye or if previous surgery has been done like glaucoma or retina surgery, then the chances of developing cataract is more. And prolonged use of an steroid, like as I said, that when you have patients are on asthma or patients are on some skin diseases, when they take an steroids, their cataract increases. So if you feel like you have some disturbance in the vision, it's better to check with your ophthalmologist, and if there is some signs of a cataract, it's better that you get the surgery done. If it's left alone, or suppose if you feel that there is some disturbance in the vision, can be like diplopia, double vision, or little blurriness in the vision, or little cloudy vision. So these are the signs. When you see that, at that time it's advisable to visit an ophthalmologist. And how to protect that or how to delay that? It's not delayed or it's not protected once it's an age related disease. Like how you get your hair graying, the same way the cataract is related to an age. And some preventive things can be done because it is because of an exposure to sunlight. So usually you can wear sunglasses if you go out in the sun, or you can wear a hat when you go on the beaches or you go on the sunlight. And also keep your eyes healthy, have a normal diet and a nutritious food. These are the things that you can do for a little delaying or a prevention of a cataract. Now let us talk about another blinding condition which is called as a glaucoma. Glaucoma is silent thief of vision. In this, you don't realize in an early age when the vision is lost, because the vision lost is from the periphery and your distance vision or the vision what you can see is clear. Now glaucoma can be, the risk factors for the glaucoma are age. When your age is above 40, you have a family history, you have a diabetes, you have a hypertension, or if you have a history of taking the steroids because of some disease like skin disease or because of asthma, if you take that medicines, so also the risk increases. Now in this what happens, the pressure inside the eye increases. Now when the pressure inside the eye increases, it gives a pressure on the back part of the eye or the back part of the nerve, which is called as an optic nerve. Now when it gives a pressure, the blood circulation to the optic nerve decreases, and because of that the vision slowly and progressively reduces. The treatment for this is, once the vision is lost, it cannot be recovered back. So the early diagnosis and prevention is the key here. Early diagnosis, you have to visit a doctor if you have all these symptoms or an early history. Like suppose you have a history of frequently changing the glasses. The best way is that go talk to a doctor, check your eye pressure checked, and then if it's high, start on a treatment, because prevention is a key. And once you are diagnosed with a glaucoma, the only treatment is that you have to either put on a drops or you can do a surgery for reducing the further deterioration of the vision. Now the advice for the glaucoma is, suppose you are diagnosed with a glaucoma. So what you have to do? One, that you have to have a regularly checkup, and then you have to change your lifestyle. You increase the light where you are sitting, and also you have to use the medications as advised. Sometimes it's said that you can skip on a meal, but you cannot skip on a medicine for the glaucoma. And then suppose if your vision is lost because of glaucoma, then probably you can use some smart devices, you can use a cell phone, or you use a cell phone and increase the font size of it. This is a lifestyle that you have to change it. And also you also maintain a healthy lifestyle, and when it is advised that, like suppose you are advised as to come after 3 months, you stick to 3 months, and once there is a progression, then you have to visit frequently, and if there is no progression, then probably you can visit every 3 months, 6 months as advised by the doctor. So we wish you a good vision and a healthy life. Thank you very much.